Hi, good day to all of you. Today we are going to see about one more complication of diabetes, and it is also seen in other patients without diabetes mellitus, hypoglycemia. So, I am Dr. Divya Joyce. I will be talking about this topic today. So, first we have a case scenario. We have a 77-year-old maid who had hypertension and diabetes, was brought to the emergency department in a state of reduced responsiveness. He was drowsy, unable to walk, and did not respond to any oral commands. Relatives gave history of reduced oral intake of food the previous day. He was taking a tablet, glimepiride, which is a sulfonylurea, 2 mg twice a day, and tablet metformin. All of you know metformin, 500 mg twice a day. On examination, patient was drowsy and he was not obeying any oral commands. BP and pulse rate, his vitals were normal. He was cold and there is profuse sweating, that is called as diaphoresis. Systemic examination revealed normal cardiovascular system and normal respiratory system. So, blood sugar level on testing, it was 45 mg per deciliter using a rapid assessment technique called as capillary blood glucose. So, renal parameters and cell counts were checked, everything were normal. So, this is the typical scenario in which a diabetic patient taking a medicine which has increased risk of causing hypoglycemia and a concomitant history of a reduced oral intake will present to us in the emergency department. So, as shown in this scenario, hypoglycemia is very common in diabetic patients due to disturbances in the treatment, disturbances in the patient's food intake habits. So, that is the most common scenario in which hypoglycemia presents, but there are certain other causes of hypoglycemia as well. So, first, what are the different terms which we use in hypoglycemia? An alert value is given when hypoglycemia, the CBG or the capillary blood glucose is less than 70 mg per deciliter. When it is less than 70 mg per deciliter, immediate treatment is needed. That is why it is called as the alert value. What is called as a clinically important biochemical hypoglycemia is a CBG less than 54 mg per deciliter. When it is less than 54 mg per deciliter, CNS manifestations start to occur. That is why it is called as clinically important. Severe hypoglycemia is any event in which the patient is not able to correct the hypoglycemia. He requires the assistance of another person to correct the hypoglycemia. Documented symptomatic hypoglycemia. Patient tells you that on a particular day I had symptoms of sweating, palpitation, which are all symptoms of hypoglycemia, and when I checked the capillary blood glucose, it was less than or equal to 70 mg per deciliter. So, you have symptoms suggestive of hypoglycemia and documentation that the blood glucose level was less than 70. Asymptomatic hypoglycemia, patient comes to you, he is conscious oriented, you just check the sugars randomly and he is having a glucose level of less than 70 mg per deciliter. Probable symptomatic hypoglycemia. This is patient complains of symptoms suggestive of hypoglycemia, but at that point of time, they did not have a method through which they could test the blood glucose levels. They consumed some food, after that only they were able to give a blood glucose test. So, typical symptoms are present, but we don't have a measurement of the blood glucose level at that point of time. We call it as a probable symptomatic hypoglycemia. Pseudo-hypoglycemia, patient with diabetes, they report typical symptoms of diabetes. I am having sweating, palpitation, I am feeling very giddy, drowsy, everything they tell you. But if you measure a capillary blood glucose or take a blood sample and run it for glucose levels, it turns out to be more than 70 mg per deciliter. So, there is actually no hypoglycemia which has to be treated in the patient. That is called pseudo-hypoglycemia. Next, we will see when we will give importance to a hypoglycemia episode, then we will decide to evaluate the cause for that hypoglycemia episode. So, when we have Whipples Triad, we give importance to that hypoglycemia episode. What is Whipples Triad? Patient is presenting with typical symptoms of hypoglycemia and then you do a checking. You do a capillary blood glucose, you take a sample and send it to the lab. There is a low plasma glucose which is documented. And there is also relief of symptoms once glucose is normal. You give them 25% dextrose. You give them a dextrose infusion, and once you give this dextrose infusion, all these symptoms will reduce. So, there should be symptoms. You should document a plasma glucose which is less than 70 mg per deciliter, and all these symptoms should disappear once you correct the glucose levels. Then it is called as a hypoglycemia which has to be evaluated, and this triad is called as Whipples Triad. One more thing that we have to see in Whipples Triad is, I told you low plasma glucose and I told you that we have to take a blood sample and send it. There is a rapid assessment technique known as capillary blood glucose, where we prick the patient's finger prick, we do a finger prick, take the patient's capillary blood on a strip and we get a rapid value. This is capillary blood glucose. This capillary blood glucose can give false values when the sugar is too low or when the sugar is too high. So in hypoglycemia, if we do a capillary blood glucose, it is not very trustable or reliable. So always if we have suspicion of hypoglycemia, we are planning to evaluate that hypoglycemia, it is better to take a sample and send and then decide on evaluation. Capillary blood glucose might not be accurate at most times when there is very low blood sugar levels.